Hello, everyone. My name is Laura Merritt. I am a student at The Ohio Christian University. This week, we're working on doing our capstone where we will do projects on topics of our preference, which I want to talk a little bit about anxiety disorder. So, my topic today will be group therapy for anxiety disorders. What is anxiety disorder? Anxiety disorder are those that share features of excessive fear and anxiety and related behavior disturbances that typically persist 6 months or more. Anxiety disorder differ from one another in the types of objects or situations that induce fear, anxiety, and avoidance behavior, and the associated cognitive ideation. The different types of anxiety disorder include separation anxiety disorder, selective mutism, specific phobia, social anxiety disorder, panic attack specifier, agoraphobia, generalized anxiety disorder, substance medication induced anxiety disorder due to another medical condition, other specified anxiety disorder, and unspecified anxiety disorder. Here you see a young man sitting here dressed as if he was a clown with a therapist. We understand that he's not a clown. This is probably used because a lot of young people are maybe in fear, or older people have a phobia of clowns. And so, what it is here, he is just hiding behind his fears, but he's doing the right thing by going out seeking the right attention and help to help him overcome this fear. The cycle of anxiety disorder are traumatizing. It may trigger the event, negative rumination on the event, associated concerns may rise, failure to treat, like a proper treatment, and or ignoring the problem. Treatment for anxiety disorder, cognitive behavioral therapy, or CBT. CBT focus on exploring relationships among a person's thoughts, feelings, and behavior. It is a collaborative, structured, skill building, time limited, and goal oriented intervention designed to target core components of a given disorder. There are several methods of the CBT that I found to be helpful in cases of anxiety disorder for treatment would be making loss or grief charts, ABC of cognitive restructuring charts, work on boundaries, teaching breathing exercises and or techniques, ways to strengthen core belief, self-talk, an urge to write a daily journal, and reading empowering books and or articles, most likely more of the positive things to help renew the mind and redirect our focus on more positive than negative things. Social psychology and group therapy. Theories of social psychology can be applied to help form and use group therapy as a method of treatment. Theories involving observational learning, self perception theory, social comparison theory, social penetration theory. A study of a study has found that the effective of daily emotional support on the incidence of anxiety disorder was significant, and the more daily emotional support one has, the lower the risk of anxiety disorder. This study also stated that a stable social network can positively influence mental health. Health psychology and group therapy. Health concerns associated with anxiety disorder or restless or on edge, easily fatigued, difficulty concentrating or mind going blank, irritability, muscle tension, and sleep disturbance, impairment in various domains of functioning, high risk for suicidal behavior, cardiovascular morbidity and mortality, alcohol and other substance use problems. Remaining healthy physically and mentally. It is good that we follow the medical compliance. If a patient does not comply with what a doctor or a therapist suggests, when the rate of better mental and physical health declines. Anxiety is one of the emotional response to a health threat. Coping with the health threat is just as important as being in compliance. We did a poll at the Georgia Psychological Center, and 21 out of 27 reported having been abandoned, betrayed, isolated, lonely. 17 out of 27 had suffered from depression or suicidal. 13 out of 27 had trouble with their self-esteem. 10 out of 27 did not feel that they were assertive. 9 out of 27 had relatives who had suffered from either BPD, depression, bipolar disorder, schizophrenia, OCD, anxiety, panic disorder, or GAD. Out of the 27 clients who were officially diagnosed with the same form of anxiety, only 18 reported having concerns with generalized and social anxiety. A longitudinal study on the effect of loneliness on social anxiety reported that loneliness at an earlier time predicted higher levels of social anxiety. In my conclusion, just wanted to remind us that it's very important that we focus and stay in compliance with whatever the therapist or the doctor is telling us to do so that we will have a better mindset and that we'll be able to cope better with our issues dealing with anxiety. Being in a group therapy also help impact the mental capacity of one to have anxiety disorder. It helps them to understand that they're not alone and they're not by themselves. And they also can encourage one another to understand that no matter what they go through, they're not alone and there's always hope for them at the end of the road. But we have to stay in compliance and we have to also focus on doing whatever the doctor is telling us to do and thinking on the things that are positive and not negative. Well, this is the end of my project. I hope you all receive some beneficial information. And I hope that if there anything that I have said or did not said, here we have several references that you can go back and reference to get more understanding and clarity as far as dealing with any form of the types of anxiety disorder that I speak about. Thank you and hope you enjoy this clip.